We use many different ways to treat cancer in teenagers. We can use surgery to treat cancer, we can use radiation therapy to treat cancer, but the most common way we treat cancer in teenagers is to use chemotherapy. And chemotherapy is not just one drug. Chemotherapy is actually medication, but it's many, many different types of medication.
The way most of these drugs work is that one of the features of cancer cells is that they divide really quickly. These drugs target those cancer cells that are dividing quickly.
And it would basically go in and try to fight every single cell that was in my body, including the good cells. But I knew that even if my good cells were being gotten rid of, that means the bad cells are also being gotten rid of as well.
Most of the chemotherapy you get will be given through your port or central line or through an intravenous in your arm.
When I got my port, I was really scared. They put like a little thing under your skin, and that's where they like access it. I guess they put a needle in it, and you just get the chemotherapy through it, so you don't have to get pokes on like your fingers or your arms. And I remember the first time the nurse was accessing it, I was like staring at her, and she's like, "You're making me nervous," but I'm really scared of needles, so I'm just like, and I kept asking my mom like, what if they miss and it like hits something else in my chest? But she obviously assured me that they're not gonna miss, and then like it's not gonna hit anywhere else.
And it can also be put into the spinal fluid by a procedure called a lumbar puncture, where it goes into the spinal fluid.
But for some diseases, particularly diseases like leukemia, there are also tablets that you need to take. Those tablets are as important a part of your chemotherapy treatment as the intravenous chemotherapy. We know from many, many studies of kids and teens who have been treated for cancer over the years that patients who don't take their medications at home regularly are less likely to be cured of their cancer than patients who take their medication all of the time, or at least most of the time.
The reason why you get a sort of treatment plan, and the one that you do, is because it's based on evidence of what works best in your situation. And that evidence is based on other people who've gone through treatment, and they've trialed sort of what medicines work best in your specific situation for your kind of illness and where it is and how it presented.
But what you need to know is we're here to help you through this. Although for you this is a very personal, very scary experience, and you feel like you're the only person in the world who's going through this, know that lots and lots of teens and kids have gone through the cancer experience, and that our role as healthcare providers is to help you get through that, because at the other end is a long and healthy life, and we need to do everything to get you to the other end so that you can enjoy that.